Good morning, everyone. It's a great pleasure to welcome to Ireland the Permanent Council members, the Board of Directors, guests and executive staff of G4 Alliance for Surgical, Obstetric, Trauma and Anaesthesia Care. I'd also like to welcome those joining the meeting online. This is a truly international audience and I'm delighted to be welcoming delegates from Africa, Asia, the Americas and Europe, and of course those of you who are based in Ireland. As human beings, our own health and the health of our family and friends and community is important. Regardless of age, gender or background, health is our most basic asset. For societies to function and thrive, we need to be healthy and to have access to the right care, including surgical care, when we need it. The right to health is fundamental to our human rights. The importance of health and well-being is well recognised in the Sustainable Development Goals and specifically in Goal 3, to ensure healthy lives and promote well-being for all, at all ages. Ireland, along with Kenya, co-facilitated the adoption of the SDGs and we're deeply committed to attaining these goals domestically and internationally. With just 8 years left until 2030, more than 5 billion people still do not have access to adequate standards of surgical care. This is unacceptable and is a situation that requires sustained advocacy. So I applaud the G4 Alliance for taking up the mandate to advocate on behalf of those furthest behind for a stronger, more resilient health systems that can deliver access to safe surgery for all. The universal nature of the SDGs is key, and our development cooperation programme is firmly rooted in the need to ensure the needs of the furthest behind are met. Working with partners, including the Royal College of Surgeons in Ireland and the College of Surgeons of East, South and Central Africa, we are committed to playing our part in the effort to reach people living in resource-poor contexts who lack access to safe, affordable and timely surgical care. As it enters its 15th year, this unique global health partnership, which we are very proud, has expanded beyond surgery to encompass other dimensions of SOTA care, including anaesthesia, perioperative nursing and obstetrics, workforce training. For over 10 years, the RCSI has been a leader in researching and implementing evidence-based solutions for better surgical systems in parts of sub-Saharan Africa. With funding from the European Union, researchers have demonstrated how the right support and supervision for non-doctors can enable them to safely deliver essential surgery in remote and under-resourced settings. This is one of a number of examples of what can be done to ensure that no one gets left behind. In 2021, I was delighted to launch the RCSI's Institute of Global Surgery. The institute is built on a proven track record in providing training for surgery with a focus on underserved populations. Since its launch, the institute has taken on several new projects, including those which will have a direct impact on women's health. While in the RCSI, you should look out for a portrait of Sister Dr. Maura Lynch, who revolutionised obstetric fistula care in Uganda. Her commitment to training future generations has ensured that even after her death, the Kitovu Hospital in southern Uganda continues to treat and cure women affected by this surgical condition. Partnership has always been at the centre of Ireland's development cooperation, and it's at the heart of the SDGs. Partnership is central to all of the RCSI's global surgery projects, and I see that theme of partnership runs throughout today's programme. Good partnerships are equitable partnerships, and I welcome the emphasis on equity and the diversity of speakers and moderators, as well as the cutting-edge mix of issues that you will discuss today. It's with great regret that I cannot join you today, but I trust you will have a fruitful meeting. I commend you and wish you every success in your efforts to ensure that safe, essential surgery can rapidly be offered to all those who need it, especially those in resource-poor settings. Thank you.